core. But first, let's clarify what is the inner core and why it's important. The inner core refers to the connecting musculoskeletal tissues between your spine, ribcage, and pelvis. Okay, let's dive into step 1, 2, 3, exercise. Step 1, we're going to determine your posture first. If you present your lower back to be arched, you're going to focus on hip flexor stretch. If you present your back to be too flat, you're going to focus on hamstring stretch. Perform hip and hamstring stretch depends on your posture, and also focusing on the lengthening of the tight muscle groups before we do any kinds of stability exercise. For a hamstring stretch, we're gonna do hip hinge motion, and then we're going to use tower. This hip hinge motion is crucial for lifting object from the ground or bending down. Be cautious not to round your back. This stretch can be done in various positions depending on your conditioning levels. Perform these hip hinge motions or hamstring stretch motions 10 to 20 times without rounding your lower back. For an effective stretch, proceed slowly and gently. Step 2. It's time to activate your pelvic floor and contract the lower abdominal muscles. This is known as pelvic rolling, focusing on pubis area, tucking it in as you exhale. Ensure the entire inner core unit is engaged. Keep your ribcage closed and your belly button firmly compressing the abdomen without slouching or rounding your lower back. If your pelvic floor muscles are effectively activated, you must observe this. Can you see that? Then this. Can you really see the movement from the bottom of your pelvis? If your hip adductors, inner thigh areas are so tight, it could inhibit the pelvic floor activations. For experts' guidance, consider seeking assistance from the qualified facility nearby. Now, let's go back to tucking the pubis. Engage gently for 4 seconds, then release. Repeat these motions 10 to 20 times, maintaining a slow and gentle pace. Step 3. Assume a tabletop posture. Flex your ankles to fully engage the entire chain of your body, front side of your body, including your abdomen. Apply this pubis tucking technique and breathing method to connect the entire inner core units as you curl your upper abdomen. Support your head as needed. Ensure that the neck remains long and nice. Begin with 10 to 20 times. All the movements demonstrated in these videos are intended for beginners. Remember, the goal of exercise therapy for chronic back pain is to restore the function of hip, pelvic, and lumbar spine in terms of stability and mobility. It might be easier to alleviate the pain than you think if you have an expert around you working with you. Our physiotherapist can incorporate treatments such as soft tissue release and intramuscular stimulations alongside the exercise therapy sessions. Thank you for watching. We will see you next video about the shoulder pain.